specialist and as a holistic healer in regards to people that may be dealing with head and neck cancer. Head and neck cancer is the common word. Some people will call it vocal cancer after a while, because the fact that the cancer spreads to the vocal folds. And no, it's not just for people that are smokers. Okay. For her, she actually ended up getting tongue cancer as a result of heavy use of drugs and alcohol. All right. That was the reason as to why she received it. And so why don't you talk a little bit about head and neck cancer, and then I'll come back and piggyback off of you, and then we'll answer some questions. Go ahead.
Okay, cool. So, and really important thing with me, I always talk about everything from a holistic standpoint. And I
Yes.
think that's really important because a holistic standpoint always encapsulates every aspect of the healing that needs to be done and needs to be addressed.
Yeah.
And so one of my approaches to healing anything, how you heal anything is how you heal everything. Okay?
Everything. Come on.
I want
wait,
everybody.
wait. Before you do anything else, everybody drop that in the chat right now. That was a bar. How you heal anything is how you heal everything. Drop that right now. I need to see y'all dropping it right now. How you heal anything is how, that's how you said it, right? Is how you heal everything. Yeah. All right. Drop that in the chat really quickly, because I think that was a bar that you just said just now. Yeah. Seriously. Okay. Sorry. Go ahead.
Yeah. And that's really important because in modern medicine, the approach they take is what's called a reductionist approach. And a reductionist approach is what they do is they segment and compartmentalize off the body. So if you got diabetes, they focus only on your blood sugar. Okay, if you got diabetes type 2. If you got diabetes type 1, they focus on your pancreas because it's all about insulin. If you got high blood pressure, they focus only on your blood pressure. Now, the important thing I'm trying to drill home here is that when your blood pressure is high, it is not just the pressure in your blood vessels that's the issue. Your heart could be the issue. Your kidneys can be the issue. Your blood thickness could be the issue. I can go on, but it's not just addressing the pressure in the blood vessels that is going to help. Same thing with cancer, right? Cancer, just to kind of give you an idea of what cancer really is. Cancer means that you got all these 30 trillion cells in the body, right? And then all of these cells are working in unison like a symphony, okay? Heart cells are doing what heart cells do, and they're helping out the kidneys. Kidneys cells are doing what kidney cells do, and they're filtering the whole blood in the body. You know, your digestive cells are doing what your brain cells, your spine, all of them are doing what they do in unison with all of the other cells in the body. They're getting along. It's a community. They love one another. They understand the importance of each other. They even walk past each other and go, hey, without you, I would be nothing. You know, like, heart, you're dope, but I want you to know I'm thankful for you. Oh, brain cell, I'm happy for you too. Okay, because without you, we could even have a conversation. You know what I'm saying? So like, that's how our normal healthy cells are working. What a cancerous cell is a cancerous cell is like, you know what? I don't care what any of you are doing. I'm going to do my own thing. I'm going to create my own little community. I don't care that it may kill y'all. If it kills you, it kills you. But I'm going to create my own little community. We're going to call it tumor. And wherever there's a weakness on a block in the body, that's where I'm going to take over. Okay? Because it's like, I'm not going to go anywhere in the body where it's strong. So I'm not going to go up there. Your heart is strong. So I ain't going to mess around with the heart. I don't want no smoke with the heart. But I can see that your breast tissue has a weakness there. So I'm going to take over that. I can see that your throat has a weakness. So I'm going to take over that. That's how cancer works. And it works that way because what happens is the DNA inside of that cell gets mutated. Okay? That's what a cancer is. It's a mutation of the DNA inside of a cell. And that mutation is basically like, have you ever like had a computer like back in the day and it got a virus and it got that blue
Mhm.
screen? And you take it into Geek Squad and they look at it and you like, it's got this
Yeah.
blue screen. Like, can you help me? And they're like, nah, bro. Like, that's what it is. That's what cancer is. It's basically a
Yeah.
mutation in the DNA or a virus in the programming. So it's changed the
What's up,
programming.
Daryl?
Okay, so once it changes the programming, what happens is now I don't have to do, even though I was a heart cell, I can rep whatever I
Yeah.
want to rep now. And so now I'm going to rep breast cancer. Now I'm going to rep throat cancer. Now I'm going to rep brain cancer. You understand? So it doesn't matter where the cancer is in the body. That's just a name. How cancer
Y'all.
functions, how cancer functions, it functions the same no matter where it is in the body. So if it's prostate cancer, cervical cancer, brain cancer, breast cancer, stomach cancer, it always functions the same. Okay? That's really important. And the reason why I'm telling you that is because, again, I said it at the beginning. The how you treat anything is how you treat everything. Okay,
Everything.
especially when it comes to cancer. So when it comes to cancer, there's a very particular way that you go about healing cancer. And it's basically the reversal of how cancer works in the body. Okay. So
Yeah,
one of
yeah,
the
yeah,
things, just to give you one thing, right? One of the changes that happens when you have cancer in the body is normally when you get the energy that is being produced inside of a cell is being produced by glucose. Okay. All right. So when somebody gets diabetes, their blood sugar goes up because the issue is that sugar is supposed to be inside of the cell creating energy. Okay. So
yeah.
that's why you
Okay,
find
wait,
diabetics.
Doctor, wait, Bobby, wait, Bobby, wait, Bobby. Y'all, I'm not gonna let Bobby go further. You know why? Because y'all need to be getting this in this master class. Like, Bobby, we can't get
Y'all
everything
going
right now.
crazy.
We cannot get. What's up, Neo?
Man, I saw y'all
You see how
live.
Bobby over here giving everything away?
I saw y'all live. I just said, let me tap, and I'm sitting here learning. You know, I got the health coach on here, and I got the voice coach. That's the best of both worlds right there. You know what I'm saying? How, how y'all feeling?
Good, man.
Man,
Good to hear.
good.
Yeah, that's what's
Feeling
up. I'm out.
feeling so good. Dr.
Yeah.
Bobby, we were just talking about some bizarre cases that come through our office, and so I was telling him that I had a client that came into my office that was dealing with tongue cancer, and so Dr. Bobby can teach this stuff to a kindergartner because
Yeah,
he
yeah.
just the way he just broke down, like the way he literally just broke it down, and this is what we're going to be doing in our master class next week because we want to be able to educate people and educate people where they can understand. I think one of the things we realize is that people just don't understand. You know what I mean? So keep going, Dr. Bobby, keep going.
Well, listen. I just saw y'all on here. I wanted to tap in, man. Y'all keep changing lives. Anybody who listening real quick who just joined, make sure y'all go up top real quick. Follow both of them real quick. If y'all follow me and don't follow them, go hit that button so we could keep dropping these keys on y'all because I keep seeing y'all saying keep going. So I'm going to get out of here, but go up top really quick, hit follow and comment done. Right now, their screen should fill up with just started following you, Why? Because y'all want to make sure you tuned into information that could really help y'all get to that next level. So, and people saying, where do they sign up for the masterclass? So make sure y'all tell them that too, because I know there's a lot of people on here right now who want to go ahead and get this game. But y'all keep going crazy. I'll holler at y'all soon.
All right, cool. Good to
Thank
see
you,
you, Neil.
Neil. Before Dr. Bobby continues what he was saying, you can go to, you can actually scroll down and click to follow me, and it's the link in my bio. It's the first tab, or you can just go to www.voiceandbodydetox.com. Do you have it in your bio as well, too,
Yeah,
Dr.
it's in my
Bobby?
bio on my page. So you can click the bio on my page and you'll see full voice and body detox.
Absolutely. So you can go to either one of our pages and definitely tap in for that. And make sure that you all sign up for the VIP because that's where we're answering questions. Okay. That's where we're answering questions. Now, one of the things I realize is that people love free information. They love free information, but never want to invest in their health. All right. And so the thing that I see here is that everybody wants you to keep going and keep talking, but after that, they get off these lives and they do nothing to continue the conversation or nothing to get the answers that they need. Right. So we want to be able to make sure that you're not just getting free information and free value tonight from the both of us, but we also want to make sure that you are investing in your best health. And that's the only reason why we're doing this masterclass, is to literally join forces together to say, hey, listen, we want to educate you. We want you to know that we do care about your health holistically in all areas. So, Dr. Bobby, continue what you were doing as people are coming in and people are finding out more about the masterclass.
Yeah, so I was just explaining like how you heal anything is how you heal everything. Because the question was like, so what do you think about, cancer in the ear, nose, and brain? And so the approach that I tell people to take is a holistic approach, and it's really important to understand how people think that when cancer happens in the breast, or it happens in the prostate, or it happens in the brain, or it happens in the throat, they're not different. It's the same cancer. It's just happening at a different location. And the really important point to understand is that it's happening there because there's a weakness there. Okay, that weakness could be created by the environment that you created in your body, with food and stress and etc. That weakness could be a genetic weakness. Okay, because just think about it. If we have children, and when we're in the process of having those children, we give them our DNA, right? So DNA we give them is a gut with irritable bowel syndrome. It means that we're giving them a genetically weak gut. Does that make sense? Okay, so same thing if, like, say for instance, if I had a father who doesn't, but if he did smoke a pack of cigarettes a day, then of course that's going to cause a lot of issues in his lungs and his throat. So I'm going to inherit weaknesses in my lungs and my throat. So I may be prone to asthma, as I'm born as a child. You see what I'm saying? So a lot of times when these situations are occurring in the body, or cancer is occurring in the body, the approach is this cancer is the same, no matter where it is. But what's important is where it's happening. Is happening because it's a genetic weakness, or either an environmental weakness, which means you create it through your habits. And secondarily, what's going to be very important is how easy is it to get access to that area. And what I mean by that is, like, say for instance, our reproductive areas are very difficult to get healing into those areas. So they take much longer. You see what I'm saying? But something like the breast, if you were to get breast cancer, that's an area that is highly perfused with blood. Okay, which means that you're going to be able to get the nutrients in that area. It means that you can get the immune system in that area. Does that make sense? Because the immune system arrives not by vehicle, it arrives by the blood. Nutrients arise by the blood. So the more highly perfused the area is going to be, the more easy it is going to be to heal that area. And so that's sort of my whole sort of holistic approach to kind of looking at cancer, no matter where it is in the body. Because, what I didn't want to do is, I know a lot of people out there have family members, maybe they've gone through cancer themselves, and I want them to understand how to look at it from an approach, of a holistic approach in terms of like how you really heal it, because there's only three things that they can do at the hospital. They can nuke it with chemo, they can burn it with radiation, or they can cut it with surgery. And those have been the three things since 1971. And
Yeah, absolutely. Go ahead.
The only thing in addition that we have to that, like say for instance with breast cancer, will be like something like a pill like tamoxifen. Tamoxifen is an aromatase inhibitor. Okay, an aromatase is created, by estrogen. Okay, but that aromatase that the pill is trying to inhibit it. In many cases, people don't know is in our bodies, we will create more aromatase. And how do we create more aromatase? You know, when we have a lot of fat in our body, fat actually produces aromatase. Okay. So that's why they say being overweight will actually cause you to increase your risk for cancer. And also having a lot of estrogen in the body, that will also do it as well. And so,
Yes.
yeah. So, yeah,
Yeah,
I would.
my mother's a survivor of breast cancer. She just rang the bell not too long ago. There's a question here. Let me answer it. So a person says neck and throat cancer. How do you know? What are some of the signs? That's a good question. So I'll go ahead and I'll answer that first, and I'll let Dr. Bobby add on to that. So some things that you can do, especially if you're dealing with larynx, which is the voice box, or the pharynx, which is the throat muscle, you may discover like maybe a lump in the throat. If you have cancer in the mouth, for example, my client that ended up having cancer, tongue cancer, sometimes cancer in the mouth may cause sores in the mouth or swelling of the jaw. So those are things that you want to watch out for. Some additional physical signs of head and neck cancer, or AKA sometimes they will say vocal cancer, because of that's my field. You will see these tumors often cause like symptoms that are similar to less serious conditions like the common cold, right? So you want to be very, very mindful of that. Changes in the voice. Okay, if you start to experience any changes in the voice, if you're getting constant headaches all the time, all right, a sore throat, or you end up getting like a cough, these all may be symptoms of throat cancer that can actually travel into the voice box, which is what we call the larynx. Other head and neck cancer symptoms could be things like pain, or if you're getting like a ringing in the ear. So those are the things that when I have a lot of clients, because, you know, I have some clients that are very like, they deal with anxiety when it comes to illnesses and sickness, Dr. Bobby. And
Yeah.
so because of that, this is one of the things that I have to educate as a holistic vocal coach. I educate on these and common symptoms of other common symptoms of like vocal cancer or throat cancer or neck and throat tumors can include things like I said, the lump in the nose, a lump in the neck, a lump in the throat, and it could be with or without pain.
Yeah.
Right. And this is something that people have to be very mindful of. A persistent sore throat. So if you are a singer on speaker on here, or just a regular person and you don't really use your voice a lot, but you still are feeling a persistent sore throat, those can be signs of just answering that question. If you are having what we call dysphagia, which is problem swallowing, all right, y'all, that can also be signs of voice cancer, throat cancer, neck and throat cancer, unexplained weight loss. All right. And even though Dr. Bobby was talking about being overweight, right? Because those things can all lead to that. But when you see signs of like unexplained weight loss, frequent coughing, all of those things are signs, especially for you all on here that are singers and speakers, changes in the voice, hoarseness, ear pain, trouble hearing. That's another one too, okay? I have a lot of singers or speakers that say to me, you know, like I feel like all of a sudden I can't hear anymore, or like I feel like I'm going tone deaf, right? So all of those things is, somebody asked Dr. Bobby, is it okay to use hydrogen peroxide in the ears?
Yeah, that's an old remedy that I remember
Oh, remedy?
my grandmother used to do to me when I would get like a headache. So it depends, and you'll notice that most of my answers come that way because like
Yeah,
if there is severe pain, you have to be careful because even if it's an ear infection, you could potentially
yeah.
have a hole in the eardrum. Okay, and the last thing
Mm,
you want to do with a infection that is open in the eardrum is put peroxide that gets into it and possibly goes past the eardrum. It could cause a lot of issues in that way. So it just depends on what you're using it for. But yeah, that is something like I'll tell you, like I probably have had every like old remedy that you can think of. Like I remember my grandmother, great grandmother, and using on me anytime, or my cousins, because I have like dozens of cousins like seeing them had it used on, but that's one I used to see all the time.
Clifton.Rogers says, I'm in Doc's group detox. I'm doing it for a tumor growth in my abdominal area, 19.5 centimeters. Looking for a good idea to approach it, and I will be doing the masterclass. Thank you. www.voiceandbodydetox.com, or you can follow myself. And of course, you're in Dr. Bobby's group already. So just click the tab on either one of our bios and sign up for that masterclass. Make sure you sign up for the VIP. That was a great question somebody asked. Dr. Bobby, another thing that I see that is common is when people have like a red or white patch in the mouth. That has been signs to bad breath. Can we talk about that for a second? And I know, but let's talk about bad breath that's unexplained by hygiene. Because those are signs that I've seen too that can be symptoms of cancer, neck and throat cancer. I have had some clients that have dealt with unexplained hygiene, and especially halitosis. And people never kind of combine halitosis and neck and throat cancer or voice cancer. So can we just stop there for a second and talk about bad breath that's unexplained by hygiene?
Okay. I can give two perspectives. One perspective is if you've ever heard of microbiome. So most people, when they hear microbiome, they think of, the gut bacteria that we have here that is very important to our overall health. But we have more than one microbiome. We got a microbiome on our skin that is so important that when sunlight hits our skin, if we don't have certain bacteria on our skin, we can't convert that sunlight into vitamin D. Okay, so we got a microbiome on our skin. We got a microbiome in our nasal passages, okay? Women have a microbiome in their womb, okay? And then we also have a microbiome in our mouth that is really healthy too. This is why, and this is probably, people haven't heard this before, but this is why it's unhealthy to use those mouthwashes that have alcohol in them, because they kill off the good bacteria in your mouth, okay? And when you kill off the good bacteria, you make way for the bad bacteria. And bad bacteria produces its own waste, its own toxins, and of course can, infect the gum line, the tooth, cause decay, but it also can cause bad breath. Okay, so that's the one. So making sure you got a healthy microbiome in your mouth is very important too. And that goes, a long way with having a healthy diet. The other thing that is really important as it relates to like halitosis or bad breath is also the tongue. And what most people don't know about the tongue, and is really not taught in like traditional medicine, and I shouldn't call it traditional, I'll say contemporary medicine.
Contemporary medicine.
Is that the tongue is also a way that we release toxins. Okay. As a matter of fact, quite often when I'm doing my one-on-ones with people, I have them stick out their tongue, because one of the common things that I'll see on their tongue is candida or yeast. Okay. So yeast will come out of the tongue, and you'll see your tongue will have a white coating. So instead of it being red or rosy red like it should be, it'll have this white coating on it. That's yeast coming out. If you have yeast coming out of your tongues and also toxins, that's also going to lead to bad breath as well. So, toxins leave the body in several different ways, and I'll tell you all seven on the masterclass when we start on Monday. But one of the ways it leads is through the tongue. Okay. And it's really important to understand that if you're bringing a lot of toxicity into the body, and then the body now has to figure out a way to get this out, and let's say it's not conducive to go out